YouTube channel, Health Awareness Tips with Dr.Mercy Kalenzi. And if you're very new to this channel, please subscribe, like the videos. Please don't forget to leave a comment for us. And to all my returning subscribers, please, I'm so grateful. Thank you for choosing to be part of this video. Thank you for choosing to be part of this channel. I encourage you, please stay tuned. And we'll always have new videos and some things that are so interesting for you. Thank you. Today, we are so privileged to host a dental surgeon who is going to take us into a topic that I'm about to share with you today. Thank you so much. Doctor, can you introduce yourself to the viewers, please?
Thank you so much. Hi everyone. My name is Tadeo Siwe and I'm your dentist. I will be sharing with you in the coming videos about dental issues. And so please like our videos, share them, and subscribe. Thank you so much.
Thank you so much, Doctor. We have a colleague with us today. Please introduce yourself.
My name is Dr. Mercy. I'm happy to be part of this crew.
Thank you so much, Jonas. Thank you everyone who is watching us. And today we are talking about halitosis. Halitosis, yes, a bad smell, a bad odor. It's never a good experience. I have a feeling in your lifetime, at least once in your life, you have sat next to someone at a party, at a church, you know, those days in class, and their odor, their breath surely wasn't a very good feeling for you. Have you had such an experience?
Yeah, of course.
Was it pleasant?
No, very unpleasant.
Very unpleasant. Share your experience with us.
Oh, mine was the worst.
Yours was the worst? Okay, yeah.
Sure.
Honestly, a bad breath, bad smell, halitosis has never been a good experience to any of us. And it's the reason why today we are sharing with you some of the causes. Yeah, we want to share with you some of the causes the dental surgeon is going to take us through so that we understand what exactly goes wrong when you are having a bad breath. Please stay tuned. Our channel will be right back.
Yes, welcome back. Like she said, halitosis is a common condition that has been coming around my dental unit. At least every out of 10 patients that come to my dental office, 4 of them always complaining of halitosis.
Okay, that's a big problem.
Sure.
4 out of 10?
4 out of 10.
All right.
And the challenge is one, they're always complaining that they take enough water and they have enough of the drinks at their home, they brush every day their teeth, and that they use every kind of mouthwash, but they have failed to get rid of the halitosis.
Okay.
So today I would love to share with us about what really goes wrong, what is the cause of the bad breath. So yes, like Arya said, halitosis is that unpleasant, noticeably bad breath that comes from our mouth when we are exhaling. And in most cases, some people call it fetal oris, some others call it breath malodor, others call it bad breath. So today we are going to share about what causes the halitosis. The causes are many, but they are normally broken down probably in 3 to 4 classes. The first one is the behavior or the lifestyle causes, and then we have physiological causes, and then we have pathological causes. Sure.
Please take us through behavior causes.
Yes, thank you so much. The behavior causes or the lifestyle, the life we live may also bring about what you call halitosis.
Okay.
And the first point or the most common one is the foods we eat.
The foods we eat, how?
The foods we eat, for example, onions, garlic, the raw cabbages, and the ginger, all these ones bring, when you don't brush your teeth, they bring about halitosis.
So as long as we brush, some of these causes are avoidable.
They are so much avoidable. It's very possible.
All
the
right.
next point is about cigarette smoking.
Cigarette smoking, okay.
Smoking automatically brings about halitosis because of the toxins that are within the cigarette itself. Then the third one is mainly about chronic alcoholism.
Chronic alcoholism, okay.
Yes, when you take too much alcohol and in quotes you fail to brush your teeth, At the same time, you just sleep like that. You have your mouth when it's very dry, so it brings about halitosis because of the acids that are produced from the alcohol.
And sorry, doctor, to interrupt you. You know, people who take too much alcohol tend to do self neglect. They don't take care of themselves, so they are dehydrated. They don't remember to do good self hygiene, and I think that's why they tend to have bad smell.
Yes, when they take too much alcohol, they forget even how to brush their teeth.
Yes.
At the same time, the body itself recognizes alcohol as a toxin. So it breaks the alcohol into acids. For example, there is an acid we call acetic acid. Oh my god, it's a common one. So that acid brings about the halitosis.
Okay.
Yes, and another one I would love to share with you is what we call fasting.
Oh yes, doctor. Sorry to cut you short. I've actually noticed people who fast a lot tend to have bad smell, and I've actually been wondering what goes wrong. I'm happy that now I have a dental surgeon and you're going to explain it.
Thank you so much, doctor. Fasting, first of all, when you're fasting, your body becomes dehydrated because you don't have enough glucose in your body and so enough energy. So you are dehydrated generally. And so also your saliva production is low.
Oh, your saliva production, yes.
In the mouth.
That's very important.
So it brings about the halitosis.
Okay.
Yes. So the other cause of halitosis is the physiological cause. Physiological cause, and mainly here we are going to talk about xerostomia.
Xerostomia,
yes.
Yeah.
Xerostomia, in short, they normally call it dry mouth.
Dry mouth.
Yes. When you have a dry mouth, you have at a chance of having what you call halitosis.
How does the dry mouth come about?
Yes. Yes. Thank you so much. The dry mouth normally comes about due to low saliva secretion.
So you mean some people have low saliva secretion?
Yes.
Why?
Yes, especially there are those people that have what you call defective salivary glands.
Okay.
So those salivary glands that are defective, they are unable to secrete enough of the saliva to cleanse the microorganisms and the foods we eat.
Okay.
So they keep in the mouth and eventually have halitosis.
Okay.
Yes.
That is good. Doctor, are there some of the drugs that cause like a dry mouth?
Yes. Oh, yes. Thank you for that good question. There are some drugs that cause what we call dry mouth or xerostomia. Okay. And the most common ones are the steroids.
Steroids, there we have like dexamethasone,
prednisolone,
okay.
dexamethasone, and then we have drugs like antifungals.
Antifungals, where you have glucophobin, ketoconazole, fluconazole.
Yes.
Okay.
All of those can bring about what we call halitosis.
Okay.
Yes.
That is very good. No, by the way, you need to be noting these drugs so that you begin relating whether if you're on chronic use of these drugs, then you know maybe that is the reason why you're having halitosis.
Yes.
Okay.
We also have drugs like antidepressants.
Oh, amitriptyline and its class?
Yes.
Okay.
All those ones can bring about halitosis.
All right.
So let's share about something about pathological causes. And the pathological causes can be intraoral or extraoral. When you say intraoral, we mean they come from the mouth, either from the teeth or from your gums. Okay. And then when we say extraoral, they may be from outside. And normally extraoral, they are always systemic conditions.
Okay.
Yes.
So let's begin with intraoral conditions.
Intraoral conditions. Thank you so much. The intraoral conditions, we now focus on our teeth and the gums, like I said. The first cause is the dental caries.
Dental caries.
Yes.
We want to know more about that, doctor.
Oh, dental caries. We call them cavities in our teeth.
Cavities.
So when you have cavities in your teeth,
cavities are the same as holes.
Yes, holes.
Okay.
So they have microorganisms and the foods within our teeth.
So when someone has cavities, when they have holes in their teeth, after eating, food gets stuck in those holes.
Yes, it gets stuck, and especially if they forget to brush their teeth, and then the microorganisms are not cleansed, and so you have halitosis. Okay. Yes. Then the other one is what we call dental plaque, which brings about what we call gum disease.
Gingivitis.
Gingivitis.
Oh,
good.
Okay.
So gum disease is caused by dental plaque. So you have to visit your dentist so that you have your teeth cleaned. So when you have bleeding gums, they bring about what we call halitosis.
So in short, infections of the gums also can give you halitosis. And the signs that I have infected gums is bleeding.
Bleeding.
Are there other signs?
Yes, you have swollen gums sometimes.
Okay.
Yes, so all those can bring about halitosis.
Okay.
Then the last one is mainly the pericoronitis. Pericoronitis is a condition whereby your flap that covers your wisdom tooth is inflamed. So if you fail to clean it very well and you don't take enough of the mouthwashes, it can also bring about halitosis because it harbors foods and microorganisms. Right. So it brings about halitosis.
Okay.
Thank you so much. And then lastly, I would love to share us about extraoral pathological causes. And these ones are mainly systemic conditions. The first one, which is common, is diabetes mellitus.
How diabetes mellitus?
Yes.
How does it bring about halitosis?
Yes, diabetes mellitus, doctor, as you know, is high glucose levels in the blood. So a condition where blood glucose levels are high in our body, it is going to, the blood glucose levels will also be the same as high as possible in our mouth, specifically in the saliva. So when that happens is the sugar-loving microorganisms.
The sugar-loving, so their numbers spike. They spike in your mouth.
So they spike and so they start breaking the glucose. So those microorganisms can bring about halitosis. We have other systemic conditions, for example, HIV/AIDS, especially immune suppressed patients.
Patients with severe immune suppression.
So
patients with advanced HIV disease.
Yeah, patients with advanced HIV disease are more prone to halitosis because they are highly at the risk of developing oral thrush or oral candidiasis. And at the same time, they're always at a chance of getting what we call xerostomia, low salivary production. So they are more prone to the halitosis. Then doctor also want to share with you that there are other conditions, for example, liver and kidney failure.
Oh, so patients with
liver and kidney diseases.
Does it happen to every patient or for patients who have severe advanced chronic disease?
Yes, severe advanced chronic illnesses of the liver and
the kidney.
Yes. So like chronic kidney failure and many others, so they bring about halitosis also. Because the toxins that stay within the liver after.
Sorry, doctor, to cut you short. Dear viewer, you know the kidney and the liver are all responsible for excretion. Yes,
sure.
They're supposed to eliminate these toxins from our blood. And I think with advanced chronic kidney or liver disease, then we have these toxins which are otherwise supposed to be eliminated in blood stay. So at the end of the day, they tend to give you halitosis. Yeah.
So those toxins that are secreted and are kept inside, they end up bringing about halitosis because they accumulate in the blood and so appear in the mouth.
Okay.
Then we have also what we call upper respiratory tract infections, for example, sinusitis. Yes, when you're breathing, because your sinuses are, especially the maxillary sinuses, they're always blocked, and so you have to have halitosis. And then also lower respiratory tract infections like bronchopneumonia, and so many other conditions. Then we have also what we call GERD, gastroesophageal reflux disease.
Okay. How does that
it is all about the ulcers or the acids produced in the stomach. So when those acids are produced within the stomach, and they also normally appear within the mouth, and so you have to have halitosis.
Okay. Right. Are there other causes that you think you have forgotten?
Not so much. Only that there are also there is what we call halitophobia. Now, hydrophobia is after we have treated the real halitosis, people even continue believing that they have
That's
halitosis.
interesting.
Yes, that's a problem, and it has been a really, really stressing moment for us. Then there's also what we call pseudo halitosis. Pseudo.
Or
it's false halitosis. Yes, it is not perceived by others, but for you, you believe that I have halitosis.
Okay.
Yes, so the only thing is to have counseling done to you so that you have to know you don't have halitosis.
Okay.
Yes.
Thank you so much, doctor. This has been a very wonderful session. I'm so grateful that I've been able to host you on this channel, Health Tips with Dr.Mercy Kalenzi. And I think you need to tell people about the hygiene. I think at the end of the day, we must have dental hygiene as a key feature.
Sure.
You must make sure you clean your mouth. Some people wake up and in the morning they begin their daily exercises today, tomorrow, full month, and there's no brushing of your teeth. Honestly, this is not good. And again, people practice the habit of brushing after meals, especially supper time.
Sure.
When you keep these food particles in the mouth, you know, like you are saying, with when you have holes in your teeth, when you have cavities, these food particles stay and they tend to harbor microorganisms which come in to break that food down. So please make it a habit that before you sleep, please brush your teeth and make sure you sleep when you have a good clean mouth. Yeah, thank you so much for watching this video up to the end. I'm surely so grateful. May God bless you. Remember to share my videos with your friends so that they can also learn. And please, when you watch, work on these tips that we share with you. Until next time, thank you.